Hello, I'm Dr. Shawn Phelan. I'm here to speak with you about head pain, primarily migraines, and another condition called cervicogenic headaches. There is some confusion sometimes in the general population about head pain. We often assume that just because we have a severe headache, or if we have a severe headache that is causing us nausea or sensitivity to light or ringing in our ears or a funny taste in our mouth or funny things happening in our visual field, we're automatically assuming or being told that that's a migraine. And that's not always the case. Migraine headaches are considered to be something that is either vascular of origin or something that's caused by a chemistry issue in the brain, usually the serotonin pathway, or it's considered to be a neurologic issue, or sometimes a combination of all three or two of them. And there are headaches that are caused by either serotonin imbalance or by vascular issues or by neurologic issues. But they are really rather rare. A true migraine sufferer should only have about 7 migraines per year. If you're having more than 7 migraines per year, there's a pretty good chance that there's an overlay of some sort. Different conditions can cause overlays, but the one I'll be speaking about today is called a cervicogenic headache. So the question is, if we're suffering from migraines, is it truly a migraine that we're suffering from, or could it possibly be a cervicogenic headache? So let's take a look at the anatomy briefly, and we'll look at the first picture here. And the first picture shows us the skull and 2 nerves that are coming out of the upper cervical spine. One is the greater occipital nerve, and the second is the lesser occipital nerve. They exit the spine at the level of the upper cervical spine, and then they transit up into the head, just as you see in this picture here. Irritation of those nerves will cause head pain. The second picture shows us the skull again with nerves traveling up into the face, and that is another area that we will see pain generated from. If we consider the fact that cervicogenic headache can cause all of the same symptoms that a migraine will cause, it will cause visual field disturbances, it will cause funny taste in the mouth, it'll cause ringing in the ears, it'll cause the sensitivity to light or the photophobia, and it'll cause the nausea. But it is not really a migraine headache. It is a problem with the upper cervical spine. So if the upper cervical spine, the facet joints are irritated, if they're inflamed, if they're causing irritation to the nerves, it will cause all of the symptoms that a migraine sufferer will be familiar with. But it is not a vascular issue, it is not a neurologic issue, and it is not a serotonin imbalance. It is simply a mechanical compression or mechanical irritation of the nerves in the upper cervical spine that's causing it. The last picture there shows you the upper cervical spine. It shows you the facet joints that can become symptomatic, that can cause this condition. And if you are a migraine sufferer, you should try to have someone examine you and find out if there is a situation that is driving a cervical spine problem for you. And if it does, that can be fairly easily treated. And it can help you get control of the situation so that you're not at the whim of the migraines. If you would like further information on cervicogenic headaches or migraines, just go to our website. If you would like us to take a look at you and figure out whether or not you are suffering from cervicogenic head pain versus migraines, then please get in contact with us. We would be happy to help you. Thank you.